This lesson covers economic influences, government, law, and policy in the community. This is just a quick overview. By the end of this lesson, you should be able to discuss the structure of the U.S. government and the healthcare roles. You should list the functions of key government in quasi government agencies that affect public health systems in nursing, both around the world and in the U.S. You should be able to identify primary bodies of law that affect nursing and healthcare, especially in the community, and you should understand what policy and politics are. Okay, you should be able to understand the relationship between health policy and politics in the nursing practice. You should be able to know what you develop and implement a plan to communicate with policymakers on a chosen public health issue. You should be able to relate to public health and economic principles of nursing and healthcare. You should be able to understand the national healthcare spending and what that means, third party payers in healthcare, health financing of services, and public health economics. We talked about this in a previous lesson, so this is just a little bit of a cover overview. The legal basis for most congressional action on health care can be found in Article 1, Section 8 of the U.S. Constitution. So there's four major health care functions of the federal government that are either direct service or a financing function or information or policy setting. So the government is going to be involved in the healthcare, either providing direct services for healthcare or financing healthcare or providing information regarding healthcare or setting the policy for healthcare. So we also have the key players here on global health level. We have the goal of the World Health Organizations is the attainment by all people of the highest possible level of health. So we have government involvement, and we also have the World Health Organization involvement at a global level. Many federal agencies are involved in government healthcare functions. The agency most directly involved, we talked about it in a different lesson, is the U.S. Department of Health and Human Services. We also have some state and local government involvement that affect nursing practice. Okay, the variety and range of functions of government agencies have a major impact on nursing, and we know funding, especially, is of one important role as far as what we do and how we do what we do and how nursing is funded is important to us. Nurses are also part of the private sector, and the private sector can influence legislation in many ways that nurses need to be aware of, especially through the process of writing regulations. Okay, the number and types of laws influencing healthcare are increasing, so we need to actually be aware of that. Because of this involvement, the political process is important to nurses. So it's important as a nurse to understand that you understand the political process that influences your nursing practice and also influences your patient care. Okay, so there's a few things I want to just kind of point out as we do this overview. Professional negligence and the scope of practice are two legal aspects particularly relevant to nursing practice. You've heard this terminology before: professional negligence and the scope of practice. What nurses must consider is the legal implications of their own practice in each clinical encounter. Okay, the federal and most government are composed of three branches. We have the executive branch, the legislative branch, and the judicial branch. Each branch of government plays a significant role in health policy. So, the U.S. Public Health Service was created in 1798. The first national health insurance legislation was challenged in the Supreme Court in 1937. Uh, Health is an important source of data about the nation's healthcare problems. So, Health United States through the USDS page is an important data. In 1921, the Shepherd-Towner Act, we talked about it before, was passed and had an important influence on child health programs and community oriented nursing practice. The Division of Nursing and the National Institute of Nursing Research and the Agency for Healthcare Research and Policy are governmental agencies that are important to nurses. I have provided you links in previous weeks for you to review those. Nurses through state and local government can function as consultants, they can function as direct care providers, as researchers, as teachers, as supervisors, as program managers. There's a lot of things that nurses do within the government roles. The state governments are responsible for regulating nursing practice within each state. So nursing practice is going to be regulated at each state level. Federal and state social welfare programs have been developed to provide monetary benefits to the poor and the older adults and disabled and the unemployed. We know social welfare programs affect nursing practice. You need to understand how that happens. These programs improve the quality of life for special populations. Those special populations we're going to call vulnerable populations, and we'll talk about those in the weeks to come. Okay, the nurse's scope of practice is defined by the legislation and by standards practiced within a specialty through the Nurse Practice Act. We talked about the government's influence on community health, but also another key player is funding, economic influences. From 1800 to 1980s, the U.S. government healthcare delivery system experienced three developmental stages with different emphasis on healthcare economics. In 1985, the healthcare delivery system entered a fourth developmental stage. Four basic components provide the framework for the developmental delivery of healthcare services. So we look at service needs and intensity, we look at facilities, we look at technology, and we look at the labor, the workforce, such as nurses. Three major factors that have associated with the growth of the healthcare delivery system is price inflation. That's a big thing. Changes in population demographics. We talked about that. Technology and service intensity. We know that chronic diseases also affect the economy. Chronic diseases are becoming a major health factor affecting healthcare spending. Healthcare financing has evolved through the 20th century from a system primarily financed by consumers to a system financed primarily by third-party payers. So in the 21st century, the consumer is being asked to pay more to solve the problems of the rising healthcare costs. A number of plans for the future payment of healthcare are being considered. All include some form of rationing. Excessive and inefficient use of goods and services in healthcare delivery has been viewed as a major cause of rising healthcare costs. Okay, so what's the takeaway? We need to know economics are important. Economics is concerned with the use of resources, including money, to fulfill society's needs and wants. Health economics is even more important for us nurses. It is concerned with the problems of producing services and programs and distributing them to clients. The goal of public health economics is to maximize benefits for services to public health providers, leading to health and wellness of the population. The goal of public health is providing the most goods for the most people. Nurses need to understand basic economic principles to avoid contributing to the rising healthcare cost. Okay? Medicare and Medicaid are two government-funded programs that help meet the needs of high-risk populations in the U.S. A majority of the U.S. population has health insurance now. The remaining uninsured segment represent millions of people, most of the working poor, older adults, and children. Poverty has a detrimental effect on health, and we know that. So health and economics, we know poverty feeds into that. Healthcare rationing has always been part of the U.S. healthcare system. Nurses are cost-effective providers and must be an integral part of the healthcare delivery system. The Healthy People 2020 also addresses U.S. health objectives to maximize the utilization of healthcare. Okay? Human life is valued in health economics, as is money. An emphasis on changing lifestyles and preventing care will reduce the unnecessary years of life lost and early preventable death. Thank you for listening into this lesson. I hope you have enjoyed this quick overview of ethical and cultural influences in community health. For questions about this lesson or corresponding notes, please feel free to email me. Have a lovely day. Thank you for listening to this lesson. I hope you have enjoyed this quick overview of economic influences, government and law and policy in the community. For questions about this lesson or the corresponding notes, please feel free to email me. Have a lovely day.